The idea today is to give you all, as the City Commission, a briefing on the activities of the various departments, what we think we're facing, and the actions that we're taking and recommending that you all take. So we've got a fairly detailed briefing for you. I'm going to start out with the chief, who's going to give you an overview of what's happening related to the pandemic itself and some of the recommendations that are coming down from the various federal agencies. And then I'm going to talk specifically about some of the local actions and recommendations that we're looking at.
Thank you, Mr. Cowper. Okay, so we're just going to start by looking at a little bit about infectious pandemics, and then we'll go into some other the specific details we got. So I got a few little slides up here, and as everybody knows by now, we are under a pandemic, which means that this has been a global outbreak. It started out overseas, and now it's here in the States, and we do have confirmed cases here in Alabama today. So this just goes over and explains a little bit about what that is and how that occurs, and this is some of those historical ones that has really caused a lot of impact in our communities throughout the last 20th century and then leading up into the 21st century here. But the 1918 pandemic results, we had 50 million people worldwide were impacted by that pandemic, with over a 500,000 people dying in the United States of America. The slides, the data we have for Alabama was not included because we had a fire at the old State House years ago, so a lot of that got messed up. So, but there is a little bit more we've got on that in a second. Then the 57 pandemic, we had a worldwide around 1 to 2 million with 70,000 U.S. deaths. And I'll go through these quickly. 68 pandemic, worldwide deaths 700,000, in the U.S. 34. And this was one of those strains of the H1N1. And then that just goes over and shows you a little bit about that 1918 pandemic results, where it started in Florence, and we ended up 3 weeks later with over 37,000 confirmed cases in Alabama. This is a worst case scenario for us, there's no doubt about it. Severe pandemic, estimations 1.8 million illnesses, 198,000 hospitalized, and over 38,000 deaths during this particular pandemic. And this was a period of time where a lot of the homes and all were a long way apart. You know, you drive down the road and the other house would be 2 miles down the road. It's a little different today. So imagine this type of pandemic occurring today, and that's just what I want to set out for you. Our challenges, of course, are the rapid worldwide spread because of the size of communities and the way we live today. So that's a big deal. Our healthcare system, of course, it can be overloaded by these challenges. Medical supplies can be inadequate. Economic and social disruptions occurring, which we're seeing some of that already, and there's probably going to be more to come. This shows the H1N1 of 2009. Now, we did have the 2003, what we call the West Nile virus or the avian flu. The avian flu is a lot more like influenza, the way it's set aside. But this just shows here the H1N1 a few years ago that everybody remembers. This is Region 2. Of course, Houston County was the largest impacted area or county in our region during that period of time. Shows that we was number 2 in the state, which was pretty impressive for our community, to be honest with you, to have that many people ill. 26 county reported cases, total cases 2,453 with 36 deaths. Now that's just here. Of course, if you look out throughout if you look at the current seasonal flu area, now you see that we have 16,000 people have died already this year in the 2019-20 seasonal flu outbreak, or that's just normal flu, and 280,000 people have been hospitalized. So just showing you some numbers to explain, and I want to go back one real quick and just show you that. Remember that number right there? That was with the H1N1 that everybody remembers so much. And then we get here today. Now this has not been updated this morning. Everybody knows it was 22, and that's probably changed since then. I haven't seen the numbers because we've been in meetings all day. But this just shows you, we do know that Jefferson County, I think, had 12, so it had doubled overnight. So we're seeing that exponentially grow. So that's the current numbers that we have. Let's see. I think the numbers that we see nationally, and I gave you some copies down here. if you look at this second page here, and I know there's some up here for some of the media as well, but this document here, this page right here shows you on the right-hand side that we've already had 3,000, and this was this morning at 6 o'clock, 3,774 cases reported in the U.S., which is it's growing pretty rapidly. Is where I'm wanting you to go with that. So we see that is confirmed cases worldwide. So this is a pretty aggressive virus, which everybody knows by now. So none of that's new. I wanted to throw just a little bit of this out there because I want everybody to understand that we want to be calm, reassuring to the public. At the same time, we need to use good caution and do that thing that we do so much in disaster management that Chris Judah will be glad to explain to you as well. You know, we pray for the best, but we always prepare for the worst. And that way we're in a good shape whenever we get down to hopefully mitigating a particular response like this. So our goal in pandemic, this document is actually written. We have an EMS committee that the commission appoints when we start looking at medical issues. Y'all been doing that for years. We bring that committee together to talk about what we're doing pre-hospital and hospital-based and what we can do to support. We initiated those meetings last Thursday. We are continuing those meetings moving forward at EM8 on this coming Thursday and growing that just a little bit, but it is a healthcare discussion that we're having for planning sessions and all that we're continuing to do. So this is set up for that as well. Communicate with our members regularly. Now, when we look at this pandemic, we're looking at two elements. We're looking at, number one, what can we do for our city and workforce to keep it where we're doing continuity of operations, what we call COOP planning, okay, continuity of operations planning. And then we're also looking to see what we can do to maintain the community and make it continuity of operations. So it's both sides of the coin. It's the workforce and the community. And the whole goal is for us to have good plans in place that provide protections, information, and do the best we can to mitigate the process and eliminate issues. Stockpile equipment and supplies, we're already working on that. We've been working on that for a couple of years, and we've done pretty well with that from a pre-hospital standpoint of being ready to roll with this kind of emergency. Support members and families, all our department heads are doing that. Maintaining annual physicals and vaccinations. This is for all of our personnel that are in healthcare especially, to make sure that we've got vaccinations that are being followed. You know, one of the things that a lot of people forget is we've had an influenza vaccine for years, and a lot of people don't take it. And imagine if we had a coronavirus vaccine today, and this was hitting us, everybody would want it, wouldn't they? So the whole point is we know we don't have a vaccine, and we know we do not have any type of antiviral currently available for this virus. That's something to remember as we continue to communicate today. But we want to review our infection control plans. I've got what we call the Dothan Fire Department Infectious Pandemic Continuity of Operations Plan, and each department has this copy, and they develop their own to support the operations of the city. And that basically shows what we're going to do, how we're going to do it, if we start getting major impact to our workforce to be able to provide essential services, et cetera, throughout our community. And that's what this does. And then, of course, attend all related meetings and conferences such as what we're doing today and being here for y'all to provide you input. The pandemic planning business should plan to be able to respond in a flexible way to varying levels of severity. You know, when it comes down to it, and there's a lot of work being done, I know, through the chambers and through the Small Business Association to make things, you know, proactive for them so that they, as they go through this, they're able to be taken care of. And there's a lot of legislation going on at the national level and state level to support that as well. A more serious, okay, we move on past that. Immediate actions, and this is what we're working on with our workforce, especially in pre-hospital services like the fire department that does your emergency medical response in the community. So one of the things we know for right off the bat is the fire department is going to be responding with the ambulance service to the sick people. So what can we do? We can't do the social distancing of 6 feet that everybody hears about. So we have to treat them and work on them. So one of the things is that we're doing everything we can to protect those high-risk employees that are out there doing our workforce every day. And this just shows the reduced transmission among staff, protect high-risk employees, maintain city operations, and then minimize spread to supply chains. And that just goes, these are just some key indicators that I'm not going to get real deep in with you, but we do know that when we start, we're already seeing them happen now. School closings, stuff like that. So we know we've got key indicators that there is an infectious disease out here or a pandemic issue out here that we've got to be prepared for. And I wanted to hit those main things today. The immediate actions, we begin exposure avoidance today, which we've already started. Y'all, a lot of people are hearing for the first time this social distancing, but now it's 6 feet. So we try to make sure that everybody understands that you try to maintain 6 feet when you're around people. Remember, this is not an airborne virus. A lot of people misunderstanding that. It's a droplet virus, according to the CDC. Which means you've got to get something on you and then get it into your mucous membrane somehow for you to be able to absorb it in your body. So it doesn't go through the ventilation system and go around and you get it that way. It's it's a droplet virus, okay? So we begin exposure by avoiding the droplets from getting on us. So we social distance, 6 feet. We are reducing a lot of events where we got large crowds. We're looking at a lot of different elements that Mr. Cowper is going to get more involved with you in just a second on. But we're trying to do everything we can to keep from spreading it and getting it. That's what this containment process is all about. So we'll do hand washing, follow those infection control procedures, keep sick people at home because that's the containment process. That's isolate the people, self-quarantine. You're hearing that word a lot, or quarantine. But all that means is we're isolating the infected people from the people that's not. So we're trying to minimize the spread of the disease. Hand washing, 20 seconds minimum. Soap and water is the best. You can use the little stuff that Commissioner Crutchfield's got right there in front of him. That works fine too. When you don't have soap and water around you, soap and water is still considered the best way to take care of it though. And then cough etiquette, coughing into your elbow, not into your hand or out in front of everybody. And then everybody's now doing the elbow bump instead of the fist bump for shaking hands and all that because we do that. But remain healthy. We do know that this virus is impacting a certain workforce. Actually, a certain base of our community. Let me say it that way. And we normally see most viruses that affect the very young and the very old, and then those with underlying problems. Well, with this one, we're not seeing, thank goodness, a lot of the young people get infected, which is pretty cool, really, when you get that right down to it, that we don't have that problem. And they're continuing to work. We call that the U-shaped process of it. Usually there's 2 legs of it as well. So understand normal seasonal absenteeism, that's just basic immediate actions that you're able to read there. And I'm going to just move on through that and then get here to the documents, and then I'm going to hush and turn it over to Mr. Cowper. So I gave you these documents here that I sent out to you by email this morning, and that's just the data. But if you'll turn over to the last page, it's got. Or you can turn over to this one, which is the easiest thing to do. This document here is the Alabama Department of Public Health. This morning, ADPH put out an immediate press release explaining some key factors about the coronavirus and what recommendations they had. And it's in alignment with the CDC, the Center for Disease Control. And yesterday we sent out this here document that we've got. And this just basically goes over and summarizes that. So I wanted to make sure you had that. I wanted you to understand what it is. They're really hitting hard the public gatherings, food establishments, and other retail venues and businesses. And no mass gatherings of 50 persons or more. They're recommending, including festival, parade, assemblies, or sporting events. Senior adults or those with chronic, and just goes over that. But this is the first time I've really seen this written as a bulleted item. For retail business, including restaurants, limit patronage at any one time. And it just goes over and shows you how some of the things they're recommending that we do to minimize the spread and contain the virus, hopefully lessening the impact to the people. And that goes over that. We're currently, based on our plan, in what we call our red response phase. And that means that every morning it tells our captains at the fire department, and it tells our police lieutenants, and it tells our supervisors at their facilities that it's time that we evaluate our personnel to see how, are they running a fever? Are they complaining of coughing? Do they have the symptoms? Because if they do, we don't want them at the workforce the workplace spreading the disease. So that's where I got a lot more, but I'll just pause, and if there's any questions, I'll turn it over to the city manager, and we'll go from there.
Thank you, Chief. One thing I would want to mention, City Manager, I think an easy thing for the commission to be able to say each time, and if this is correct, is that we're taking at least the minimum standards that are put down by the State Department of Health and the other state departments, education as well, and following their guidelines at a minimum. Is that pretty safe to say?
I'd say that's safe to say,
Okay.
yes, sir. So I have a working document here. This is a document that I'm just going to use for some talking points, and this is an internal working document for myself and you, management staff. Obviously, things are changing very quickly. It's a very, very dynamic situation, so this may change later today. I just don't know at this point. But this is kind of a snapshot of things that we're evaluating, looking at, actions that we're recommending, things that we've already started to put in place. And I may jump around a little bit on this, may not necessarily take it in order, but just to start out with things that the commission that we'll be looking at moving forward. So as the chief mentioned, we're working with CDC guidelines. What they're telling us is to limit gatherings, and that is for an 8-week time period, which puts us to May the 8th. And so keep that date in mind as we move ahead. So in terms, tomorrow we will have a commission meeting, and in order to be responsible there, we do want to implement some physical, social spacing in as much as possible. We recognize that our meetings are public meetings, and the public needs to know the business that's happening. The media, of course, will always be invited to attend. But we're going to ask the public not to be there if they don't have business. We will be live streaming that meeting as we always do, and there will be facilities in the lobby where people can watch that. We do have a public hearing that's scheduled for tomorrow, so we'll call people in as necessary to conduct business. One of the items that we would like to be considering for tomorrow is a local emergency declaration. That is the code section that's referenced, and will just generally give us the ability to make decisions quickly and direct resources where they need to be directed. This authorizes the mayor to do that. I think historically the commission has participated in that decision as well. So we'll talk some more tomorrow, but expect to see something on your agenda about this tomorrow. Any questions on any of that? Okay. We are expecting later today that the Joint Information Center will be activated. That will provide kind of a clearinghouse for public information and coordinated efforts in terms of getting information out to the public. We will have staff participating in that effort along with the county and EMA officials. Chris Etheridge, Deputy Fire Chief, will head that effort up on our behalf. The EOC has not been activated to date. They are on standby to activate, and will do so when that becomes necessary. So I don't really have any timing for that. Obviously, we're monitoring very closely the information that's coming from federal and state resources, particularly the CDC guidelines, and you're probably seeing a lot of the same information that I am on the news. Other cities taking various actions about public gatherings, events, even as many going as far as requiring assembly type businesses to close at particular times, bars, restaurants, things of that nature. We're not recommending anything with respect to private business at this point. I think they'll take actions on their own to be self-limiting, but we'll continue to monitor that and recommend action that we think is appropriate if that looks like something we need to do. We've got a very coordinated community relations effort underway right now. In just a few things, we want to be a clearinghouse for public information, so we're compiling a lot of resource information, links on websites and things of that nature where the public can go to find information. One of the things today that's come up is price gouging, and unfortunately that is something that may happen, so where do people turn to? So we'll have information available about that sort of thing. We're concerned communication with the press, communication with the public, communication with you as decision makers, and communication with the business community, and communication with our own city employees, and how they're to handle this situation. A couple other things, and again, this is a brain dump of everything that we're working at, so I recognize it may be a little discombobulated right now, but I'll try to keep it together for you. We have things coming up. The census is coming up, for example. There's going to be impacts with that. We have a number of events planned to kind of get the count. I don't know how that's going to be impacted at this point. We have an election runoff that is coming up in the near future. Several of the polling places are city facilities. How is that going to be impacted? Certainly, we've got questions, and we'll have to monitor that. And decisions may well be made for us at the state level in those terms. In terms of our city personnel, we have suspended all non-essential travel at this point. I can't think of any travel today that would be considered essential outside of myself or a couple of others having to go to Montgomery for meetings or things of that nature. We're looking also at putting in place monitoring for our city employees, particularly if they've traveled. Spring break for a lot of folks is next week. They may have travel plans. A lot of their travel plans may well have been canceled at this point, but certainly we want to be aware if anybody is going out of the country or going to greatly impacted areas, so that they're not possibly impacting our employees. So there is a possibility of some sort of self-imposed quarantines as a result of that. We have not implemented anything yet with respect to flex shifts and telecommuting, teleworking. We are asking the department heads just to consider that as a possibility going forward if the need arises for us to implement those measures. We've asked also that they look at cross-training opportunities and making sure that the department heads, assistant department heads are kind of maintaining some separation so that not everybody, somebody in leadership isn't sick at the same time. We'll have lots of issues where we think employees are impacted by school closures. We're going to have a lot of folks that are going to need to stay home with their children. That's going to impact the workforce. So we've got to look at cross-training opportunities and the ability to move employees around as they're needed and to support different efforts. Of course, our essential operations are public safety, utilities, and sanitation. Those will be our key operations that we will keep going. Staff is monitoring the federal legislation that's coming down and the possibilities of leave, sick leave. The House bill, I think, contains 14 days of leave for folks that have to stay home with children or who are sick themselves. So Delvick and his folks are monitoring that. We've already set up payroll codes to code any of this leave time, extra time that's being worked, so that we can be prepared for any federal reimbursements that may come down the line. So all of that is being tracked. Child care is, again, going to be a big issue. We haven't made any decisions there, but if the need arises, are we going to be able to provide child care ourselves for our essential personnel? Don't know the answer to that yet, but certainly those are all issues that we're having to look at. Leisure services, Civic Center is greatly impacted. The recommendations are to limit these types of events, and again, we're looking at an 8-week time period, so that is through May the 8th. That's a very extended time period. Most of the concerts and events that are scheduled for the next 2 to 3 weeks have already been canceled, postponed, rescheduled. We are contacting others further out and saying, expect that you'll probably be rescheduled. We haven't done that yet, but I think that's the direction that we'll probably be headed. With our events, in terms of leisure services, a number of athletic events have already been canceled and postponed, and we're in contact with the organizers of anybody that falls in that window. But again, most of that is just happening. Those events are being canceled. The senior center is closed. They will be providing meal services to the seniors, and that's going to be available to them to drive up, or they will be doing some deliveries. A major concern for us is the various feeding programs associated with the schools and the after-school feeding programs in particular. We have feeding programs at Andrew Bell and at Wiregrass, and we'll be continuing to do those programs, but we will not be allowing the kids to go there and congregate and eat there. We'll be setting up a scenario where, if the parents drive or they're old enough to drive, they can go through the drive up, or they can walk up and be handed food to take home to help them. Anything that we can do at this point to limit those large-scale gatherings. Of course, we'll be mindful of security needs and public safety for all of those events. In terms of our utilities, obviously there's trying to get ahead of this. If people are impacted work-wise and they're not able to earn a paycheck, then they're going to have difficulty paying their utility bills. We want to be sensitive to that, and particularly that we're encouraging people to stay home. So they'll need to have their water, sewer, power available. We plan to extend or provide a 30-day cutoff grace period where we won't be doing any cutoffs. I think we will likely have to extend that further, but we're going to start with 30 days and reevaluate that and extend it further if need be. Also, with utilities, we do plan to limit our customer service operations at the utility payment center across the street. We're going to encourage people to use the drive-through facility. We're going to encourage them as much as possible to pay their bills online, to email and call in requests for new services. Anything that we can do to kind of limit that public exposure. I expect that we'll be able to send something out in that regard this afternoon.
Maybe additional drop-off locations?
Yes, that's a very good idea. We can do, we want to make it obviously as easy as we can to pay the bill. Public Works, they're continuing their operations. Their major focus is going to be on sanitation services. They've already started to implement employee, activities such as, not allowing those sanitation employees to congregate and spend a whole lot of time around the time clock, things of that nature, to keep them separate from other employees. We need to keep these guys healthy and able to work. We've got to be able to provide sanitation services in particular. We will continue public works operations, maintenance operations. We're not going to be out there actively, for example, cutting roads and doing things that's going to create more work for ourselves. We want to keep that labor available for whatever maintenance activities that we may need. The court system has taken care of itself. Court is canceled through April 16th. That came down from the Supreme Court Justice, I think this weekend. I'd expect that will be extended beyond that date, given the 8-week guideline from the CDA. We'll just continue to monitor that. In addition to the customer service for utility payments, really our other biggest interaction of customers is for business licenses and business permits. They have set up a couple of kiosks upstairs so that people can do business at the kiosk and limit, again, their exposure to employees and that one-on-one interaction that they might have. Also, information will be available online for online permitting, but they should be able to, if somebody needs to drop off sets of plans and apply for permits, all that should be able to happen very easily with limited human contact. Just a few notes on finance. Obviously, focus on payroll and our ability to purchase the goods and services that we need. Kind of probably premature at this point, but there will be financial impacts to all of this that will start filtering our way probably in a couple of months down the road. That's definitely something that we are going to have to take a long-term strategic look at. Don't know what the impacts will be today, but we certainly need to be mindful of that. We're plan to coordinate in as much as possible with the Chamber of Commerce to communicate with our businesses. I'm sure that a lot of them are going to be very greatly impacted and looking for help and assistance. So we'll be monitoring, whatever programs that we can assist with in that regard. Focus at facilities will be, just putting up some basic signage, asking people to maintain their distance and to use good sanitary practices, making sure that we have staff in place that's keeping the facilities clean. Obviously, if you don't have a lot of people coming and using those facilities, that will be limited, but that will also give us a very good opportunity to use our resources to get those facilities as clean as they possibly can be. We do have some other boards and commissions, Planning Commission, and I believe DDRA are scheduled to meet this week. We're asking all the boards and commissions not to meet unless they have specific business that they need to meet about. But recognizing we do need to conduct business, for example, with the Planning Commission, so we'll be asking them to implement the same practices that we're asking you to implement. So we'll limit staff, we'll limit public attendance, but we'll make the public ability to watch online and attend those meetings if they do, when they have the business that they need to conduct. So there's probably more. That is a whole lot of information, I know, in a short period of time, but I want you to know You know, I've personally been on the phone all weekend, researching things all weekend, in contact with the mayor, the county commission chairman, Chief Williams. You know, we've started mobilizing things as quickly as we could, and you know, every time we get going, things change and new recommendations come out. So we're having to be very nimble in what we're doing. The staff is doing a great job. Your department heads are doing a fabulous job. Everybody is on top of things. Everybody is calm. Everybody understands the job that needs to be done, and your team will make sure that job gets done. So any questions that you may have that I can answer, I'll be glad to. I do have a limited number of staff here today. We've got a larger management team. I've also created a smaller team consisting of myself, the assistant city manager who will cover city operations, personnel director who will cover employee issues, and Chief Williams who will cover the emergency itself. That's kind of your core team that will be coordinating this and communicating with me and you. Questions?
In addition to the 6 foot, are we trying to follow the 50 person gathering? So any department that's got more than that, you're trying to
Yes.
separate them?
Yes, and that's you know, for the most part, in public works, utilities, those guys are out in small crews. The major problems are in the mornings when they get there, they want to clock in. Of course, you know, may you know, be getting daily briefings and socialization. So we'll be limiting that. We'll be asking them, you know, wipe down the equipment all the time that they're using. They're going to be in small confined spaces, so they need to be you know, practicing good hygiene and cleanliness. But yeah, that's a great point.
Chief, you talked about this and alcohol. Now, at home, we clean with a lot of Clorox. Does that do the same thing?
Yes, sir, it will. It's just, it's harsh on your skin and
Yes,
stuff like
yeah, I
that.
know.
So, you know, they got other stuff they recommend you use
Right.
instead. But, you know, we still use a lot of Clorox to kill a lot of things from the pre-hospital setting that we have with blood and other, you know,
Okay.
body substances such as that. So, yes, sir, it works okay.
Okay, thank you.
Chief, what is this Joint Information Center? What is that, is that police, fire,
And no, sir, that's.
city, county?
It's, yes, sir. It, basically what it is, National Incident Management System requires for any disaster management that we pull together a joint information center that's managed by our EMA director, Mr. Chris Judah. And there should be a press release going out about now, if it hadn't already. We was getting the final approvals from the elected by the mayor and the chairman of the county commission. And that should be going out. But basically what that does, Commissioner, is it gives us one voice. So, you know, the city has its own stuff it wants to say, and then the county has its, and then the hospitals have theirs, and the school system have theirs. And what this Joint Information Center does is it's a routing mechanism to make sure we're all saying the same thing and we're one voice speaking out, so it's not confusing and conflicting to the public. So it basically is one of the things that they found near 9/11 that created a lot of the trouble when they developed the National Incident Management System, was that we need to have a clear message going out to everybody. So it doesn't take away the individualism of the people being able to put out their own messages. It just, we're asking that it goes through this JIC, this Joint Information Center, to ensure clarity and that we're all putting out the same basic messages.
That'll be at 1:30 tomorrow at EMA building.
1:30 tomorrow, we have a press conference that will be taking place with individuals that I believe at this time, Mayor, you want to announce who they are? I mean, I think it was you and the county commission chairman and our school system and our hospitals and all
Right.
that are going to be there for the media and a press conference.
Sure.
But is it at the Joint Command Center?
Yes, sir, it will be at the 911 EMA building over on Adams Street, does I remember right? Yeah, Adams Street.
It's treating it just like if it was a hurricane had come through.
Yes, sir. And this is under our civil emergencies ordinance. It's the same as if we have a tornado or a hurricane or a major fire or any type of natural disaster or man-made disaster for that. So the whole thing is that it's all under that same umbrella. It's disaster management. It's emergency management. And we're trying to take care of it and working real closely with trying to get that done. It's time for us to move, I think, together with the Joint Information Center. So we're doing this, and I'm really, the county is working really close with us. Chris Judas does a great job with the EMA of making sure that everybody's on the same page. So we look forward to being able to be there for the public and hope the temperature continues to stay where it needs to be, and maybe we'll have minimal impact, hopefully. So.
We're gonna-
I had a question too.
Oh, okay. Let me, on that point, we're gonna Facebook Live, that tomorrow, if that's not, is that correct, Chief?
I'm sorry, say that one more
Facebook Live it so that people can tune in.
Tomorrow?
Yes.
Yes.
We want the public to be able to tune in, because we really don't want a lot of people coming there. That defeats the whole purpose of what we're trying to do, which is keep all of us apart. So we want to make it available, that type of information, and updates in the future as well that comes out of the JIC, I would assume would be also, could be made to where the public could listen in as well.
Absolutely, Mayor. You know, that's why the media is so important. The media is one of our partners that we utilize whenever we have these type of events, because they help us get the word out. Because especially with a pandemic, because we're not wanting everybody to travel. That's the whole purpose. We want people to stay, you know, the more they can, and I'm not saying at home, but they need to, you know, stay in those small group areas, if you will. And the media helps us get the word out. It's a little different than we have with our hurricane and tornado management. So it's a little unique for us because of us trying to do this social distancing at our meetings, so that we're preaching the same thing. You know, this is hopefully the last time we're all together. We're not 6 feet apart. You know, right here today. So hopefully we can continue to move toward doing that and getting the word out a little better. But that's the purpose. And I know it seems a little awkward even today because of the briefing and the way we're doing things, but we're just trying to minimize public impact and use the media to get the word out.
The after-school feeding program that's at Andrew Bell and Wiregrass, is that still going to be for the kids that attend that, or is that open to kids period, or just for the kids that usually attend those after-school programs?
Well, that will be open to all the kids, not just those that usually attend that program. You know, we would expect that there'll be some others that will come to that, and they won't be turned away.
Yes, sir.
Chief, what does a person need to do if they feel that they have contracted the COVID? What do they need to do? Do they go straight to the hospital? What do they do?
Well, or their doctor, or one of the immediate care type centers. It doesn't have to be the emergency department. Matter of fact, if you have a physician, you can use that. It actually cuts down on the number of emergency room visits because they get really busy. If they start having, you know, the things that we're looking at most often, and this is something everybody needs to remember, since there is no antiviral. The only thing that the physicians can do is prescribe medications and support for the symptoms. And what I mean by that is, if a person starts having fever, well, the fever is a symptom of an illness, okay?
Right.
They can treat the fever, but they can't treat the underlying cause of the fever because there's nothing to attack that right now. So the fever, if people start having fever, if they start having coughing, unproductive cough, that kind of thing, because remember, this is a respiratory illness. And so it's affecting the lungs and it's affecting all that, and upper airway, lower airway. So we need to make sure that it's signs and symptoms of that. So coughing, fever. We've been saying travel beyond the borders, but now since it's really here, we're saying if you go beyond the Wiregrass, because currently right now, knock on wood, there is no confirmed cases in the Wiregrass. Now we do believe that will happen. Yeah, that's why we're preparing. But right now we don't. So we minimize travel even away from Dothan right now, because I think in Lee County there's been some confirmed cases. So just a couple hours away from us, we know we got confirmed cases.
It looks like at CVS that they're setting up for the drive-through testing. I don't know when that will happen, but that's what it looks like on the east side of it.
Yes, sir, they are now. They're doing that in Lee County, and they're doing that in a couple other places. Remember, they're doing symptom evaluation. So they're asking those 3 questions, which we're asking those same questions whenever we talk to our firefighters and paramedics, and we're asking those same questions in the 911 center. When someone calls up and says, I've got a cough, we're asking a few questions to help support that. Our medical directors made changes for that, so will help us sort of determine what we're going into. Do we need to gown up, mask up, et cetera, that kind of thing. And we're not doing overkill. We're doing good treatment there. So one of the problems is I believe that Dr. Krista, our medical director, made the comment the other day that we're still around a 3 to 5 day testing period. So what that means is that it takes that many days for us to get it. So what they're doing is when they have someone that thinks positive, they're driving to Montgomery to have the test done, or to Lee County now, and basically waiting for the result. So you can contaminate a lot of people basically in 3 to 5 days if you have the illness. That's why everybody's pushing so hard with social distancing, trying to contain the virus the way they are.
Chief, if I think I might have it, want to be tested, I shouldn't just walk right in. Should I call first about where I'm going so I don't walk into the
Yes,
front?
sir.
I mean, is that, I thought I saw that somewhere.
That's the guidance that I think Southeast Health put that out the other
Okay.
day, that they wanted us to do that.
Okay.
We have a meeting that we do every week with both hospitals, emergency departments primarily, on how we're doing pre-hospital services and that kind of thing. The ambulance service, the fire department, all of the people that's a part of our emergency chain that we have is meeting. And that was one of the things they said that they wanted to do, is to please just call us, because we can help you on the helpline. And not have to see you. But they also caution, if you feel that you need to get help and you really feel that you've got the signs and symptoms that you're worried about, you need to go get seen by a physician. And we say the same thing pre-hospitally. We'd rather you be evaluated and know for sure than to take a chance and it be some kind of underlying problem that could create more difficulty for you.
City manager, on our police department, we're doing 8 hours or 12-hour shifts now.
12.
We're doing 12. Okay, that's good.
Kevin, you mentioned the emergency declaration. Is that something we're gonna deal with tomorrow?
Yes, sir.
Go ahead.
Yes, sir.
What specifically does that allow us to do, or you to do, or?
Well, it'll allow us to move ahead with some emergency purchases if that becomes necessary. I'm not aware of anything today, but if that becomes necessary. And then just some basic decisions dealing with personnel. We're talking about things like the flex shifts and moving personnel around, leave, whatever the case may be. Just allows, I guess, some more expeditious decision making on that. And of course, I'll keep you guys in the loop on everything that we're doing.
We did that with the last storm, and it worked real well.
Yeah, we would do it pretty much for all of them, and as Mr. Capel was saying, that's the primary. The secondary is that we'll put a copy of it in emergency management, so that if there is any federal declarations and federal funds, by us having that state of emergency, we can apply for those the same way we do with FEMA when we have natural disasters in that area.
I know a lot of the other cities have already declared that, or are declaring it
Yes, sir.
today, I
Yes.
believe. I was on a phone call yesterday with the 9 other cities, larger cities. And most everything we've talked about today, they're doing today or tomorrow as well. So I think we're right in line with most everyone else with what we're doing. A minute ago, you said something about the test kits and driving to somewhere. So we don't have test kits here in Dothan yet?
We are
I think people want to know that.
We're supposed to be. I don't want to say yes or no, just because I know that they're coming and I don't know if they're here today yet.
Okay. And
So
all of these.
We're making preparations.
And all these specific questions can and will be answered better tomorrow at our first press conference.
Yes, sir.
Again, those that are with us a lot, because I'm getting a lot of questions, by the phone. Those that are with us on our live stream, more of these types of questions will be answered tomorrow by those officials.
Yes, sir.
Those types of questions I really would like the hospitals and others to answer.
And there's a lot of things, Mayor, that's changing every minute, basically, and we don't know all the truth, so we don't want to put something out.
Right.
and we
For
don't know.
instance, what do you do if you start feeling sick? Those are really the type of questions we want the hospital
That's right.
to answer as well. So again, we were here this morning for a briefing. Thank you. Anybody?
Other questions? Okay, well, just, I hate to be blowing up your email boxes and your text messaging and everything, but we'll endeavor to communicate. I've asked the chief to send y'all information as he's saying. We're getting it at the same time I'm getting it. We'll be prepared again tomorrow. We have a meeting already scheduled for tomorrow. If things are changing, Chief and I others will be prepared to answer any more questions that you might have.
And then tomorrow as well, at that meeting, letting the community know if they have questions, who do they send those questions to, who can answer them, how they're gonna get the next update, when the next update, all of those questions could be answered then tomorrow a little bit better than today. So I just wanna make that clear, if that's correct.
Yes, sir.
Okay. All right.
Thank you, sir.
Yes, sir.
you.
Thank you.